Thank you both for joining me on the Decisive Healthcare podcast. How are you doing today?
Fantastic.
Doing well. Thanks for having us.
I'm really excited. I believe this is the first public conversation between Medecision and Excell since your integration. Correct me if I'm wrong on that. But first off, congratulations on this milestone. Would love to really start here. What does this union mean for healthcare, the healthcare ecosystem, and more importantly for patients? Ken, why don't you start, and then we'll kick it over to Mike.
Jared, thank you so much, and appreciate having Mike and I here today. When we were always doing our strategic planning, we're always looking at how better to serve our customers, better help them achieve their ROIs, et cetera. We realized that there is an incredible gap or opportunity, depending on which side of the fence you look at it, that, technology by itself can only go so far. And being a technology provider, I understand that. Obviously, we try our best as a technology provider to do more, but we recognized our limitation, as all technology providers have, in helping customers get the ROI that they need fully to get the operational change needed to leverage the technology in the best way. So when we set forth our strategic plan, we recognized that we wanted to build out this consulting opportunity. And then that's where we've been partnering with Mike and Excell Healthcare for a number of years now. And they were already helping us with a number of customers and helping them achieve. We saw the great work they did. And then when we got into 2026, we really saw the opportunity to bring consulting technology together when we get into this whole world of AI, right? AI by itself is absolutely going to make the world even more complex and more confusing. I think it's MIT and Harvard have either 95% or 45% of AI projects are failing, not because of the technology, but because of everything that needs to go around it. So we saw already an opportunity to wrap consulting with our technology to provide greater value to our customers and help them achieve their ROI as promised. But we saw an expanded opportunity as we get into this AI opportunity. And that's why, we went forth and we did the strategic acquisition with Excell.
I want to make sure we give Mike a second. Thank you, Ken, so much for leading into this conversation here today. I really appreciate that. Mike, I want to give you a second too. You've worked alongside Medecision for quite some time. What does this partnership unlock that wasn't possible maybe before through your lens?
Yeah, well, sure. I think Ken touched on most of it, but what we recognized, and it was a good mutual relationship to have with our co-customers, so to speak. One of the most recent ones was probably like a year and a half ago, where we successfully installed a multi-million-dollar health insurance plan, a multi-million member health insurance plan in less than 9 months. And it was a total success. And we said, hey, we can do this together. Well, this is something we're good at. We have deep, clinical experience, operations experience. We know the word ecosystem comes up a lot, but the idea that, hey, any of these systems stand alone in a silo is wrong. And so our folks bring the experience of how all the various systems touch each other. And so when you're bringing in technology, bringing in new applications and the like, they're able to navigate that, help the organization promote it and promote it successfully. The second part of that discussion, and why now, as opposed to why did we do this 5 years ago or 3 years ago or whatever, is imminent. It's starting to really take place. There's case studies now, even though all the success rates aren't there, it's going to be successful. And there's very well proven outcomes that are there. So we need that from a consulting perspective to be able to tie that to a technical platform, a technical capability, a technical expertise that we don't have, but we have the business expertise. With a blend of that, it becomes a very powerful offering in the health planning community, and there's a big desire for it. So I think we're at the right place at the right time, and it was the right thing to do this year.
I want to stay on you for a second, Mike, to kind of go into another segment really around defining today's challenges. So, you've led organizations through some serious transformations over your career. From your lens, again, what separates teams that thrive through change versus those that just survive?
Well, I think it starts at the top. I think, you need to create a vision, and that vision needs to be articulated. It needs to be formalized, and it needs to have a real strategy and a roadmap tied to it. Folks, teams that work together well, organizations that we're able to help, we see that We use the term, we take your vision from whiteboard to reality, but it is that. It's saying, hey, let's get everybody on board with that vision, everybody rowing in the right direction. And then with the right partners, technology partners, business partners, legal, and so forth, you need everyone at the table. But when you have everybody swimming in the same direction after the same target with measurable results. So the results have to be measured, have to be defined outcomes that you want to get to. We find that those are the organizations and the projects and the plans that succeed the most.
And now, like, I want to kick it over to Ken in just a second, but I think most of us will agree healthcare is at a breaking point. Shrinking margins, evolving regulations, expectations to continue to rise. Going over to Ken, and then Mike, we'll give you a second to touch on this again. But when you look across the industry, what do you think are the most urgent challenges leaders need to address first? So, Ken, over to you.
When you think about applying these projects in, I think the first and foremost, especially with healthcare, and I'm fearful that it's going to get lost, having quality data and quality data management is going to be critical to any of these, whether you're implementing a new workflow, whether you're implementing an AI strategy. I'm fearful that we as an industry will try to shortcut that. Healthcare is not short of data, right? We have lots of data, but how do we use it effectively, I think has to be tied with that proper data quality management. And that's, was really the first thing that we redid at Medecision when we re-platformed, right? We re-architected the platform. We brought forth a new capability. The first thing we wanted to do was solve the data problem. And we understand how hard that is and how easy we've made it, as Mike articulated, the implementation with a multi-million health plan was primarily how we solved the working with their data, right? From data activation to go live was only about 30 days, right? Because we have demystified how to work with data and actually find those moments that matter most for intervention, right? Just in how we do it today. Layering in AI, I get worried that we're going to skip that. So I would say first things first, you have to have proper data quality.
Now, Ken, one more question for you before we kick it back over to Mike. Where do you see AI fitting into reducing that the friction for clinicians, really helping them work at the top of the license? I know that's someone told me that's a phrase that you like to.
It is, and I think you said it earlier. All of the health plans and folks that are taking on risk, whether it's a VBC or an MSO, et cetera, those entities are under attack, right? You've got regulatory changes, you've got interest rate, you've got public perception, you've got now changing reimbursement. All of those things are putting, as you said, more and more pressure. And I think the reality that we are trying to provide our customers are two simple things: ways you can effectively reduce your administrative burden, enabling your users to work top of license. And the other thing is to unlock new medical cost savings in a very simple approach. We apply that through how we deploy technology, to how the platform is, delivering its AI, to how we even price the platform, right? Making it very convenient and easy for you to quantify your admin savings and see that in real time, to unlocking more medical cost savings. Just those two things.
Anything you want to add, Mike, before we move on? Mike, I think you're muted.
Sure. Can you hear?
Good. You're good.
Sorry about that. I think to Ken's point around the data piece, it's major. And I want to reflect on that before I reflect on what's going to happen with the providers, but because it all leads to that. There's data silos. It doesn't mean that data is bad within organizations necessarily, but there is some. But otherwise, there's these silos of data all over the healthcare landscape. There's claims data, there's care management data, there's EHRs, there's files, and things don't talk. And we need for the whole clinical side to improve healthcare and improve the cost is get that longitudinal effect around a patient. Be able to say, hey, from beginning to end, how is the care being delivered? Are there any follow-ons that aren't working? Being able to get a better picture of the entire episode of care all the way through, and having that at the desktop, AI now gives you that strategy to do that. We have to clean up the data underneath, make sure that's tied together correctly. But once you do that, and the AI and technologists can leap into that, there's a lot that can be done.
Staying on you, Mike, for a second, and then we'll give Ken a chance. AI has really gone from just being a buzzword. I don't want to say the last couple of years, because it seems like it was not just a buzzword the last maybe year and a half to 2 years, but it went from being a buzzword in the room with every client conversation. How is that shift change the way each of you talks with customers now that it's not just a buzzword?
Well, I mean, there's case studies and there's proof of concept, vehicles now where we can show it. We can actually demo AI in action. The learning curve has come up, and now the technology folks have either caught up with the business acumen folks or vice versa. I'm not sure where the race is being made there, but both of them are coming together. It's a nexus, and now you're starting to see those activities. Are they large, wide scale yet? Not as big as we'd like to see it. We're starting to see pieces work, but what it tells you is that the power of it is proof that this is going to be a game changer, which we haven't seen in 30, 40 years of attempts to try to streamline and make cost effective all the underpinnings of the healthcare process. It's exciting.
I agree. Yeah, I'm very excited by how conversations have shifted across the board. Ken, is there anything that you want to add before we kind of move on here?
Yeah, I think what's most important is, and what I enjoy the most about this conversation that we're having now, it's about outcomes. It's not about the technology, right? Because technology, honestly, is becoming, the bar is lowering, right? Dramatically. Deploying an agent, deploying an agentic, or deploying AI. I mean, your own family members are doing it at scale now, right? So the technology barrier is coming down. I think that, to me, has pushed all the conversations to outcome driven. What outcomes can we derive? How do we get the best value? And I think that, to me, is what's most exciting, because it's not about the technology. It's about how do you deliver it? How do you deploy it? How do you change your operations? And that's why, we're excited with the combination of Excell and Medecision to really be at the forefront of those conversations, to be able to deliver on that. We're not just delivering technology. We're delivering you the technology, of course, but we're also wrapping it with the right skill sets, the clinical expertise that Mike and his team have brought.
Staying on you, Ken, for a second, I read somewhere that you've said in the past, the goal is to make utilization management feel more like the Mayo Clinic, less like the DMV. Absolutely love that. But how do you make that real?
You actually said that, Ken? It's great. I agree. By the way, Jared, I haven't heard it, and I agree. So go ahead, Ken. I'm sorry.
So no, I think it's really simple. We always forget, and just like the DMV forgets, there is a human on the other side of these transactions. And it's not just a provider, it's not just a payer. There is the patient who needs to get the right care at the right time. I think we now have, whether you talk AI, you talk interoperability, we are close to that vision of moving away from the DMV to the Mayo Clinic. We're not there yet. I think we have to pull it together. We know we can do that with our clients. We are excited to see what we can do together as we get into 2026 and really get this into scale. We're already seeing it scale with over 20 million lives to date, deploying interoperability at scale, et cetera. We're really excited that we're going in the right direction. I think everyone's moving that direction. We're now not afraid to talk about utilization management. It is a key component to getting the right care at the right time. And I think that, to me, and we're not forgetting the patient. At least when you're speaking to Medecision Excell, we're not forgetting the patient. But I'm really excited to see us get to that vision.
Shifting
Background
focus.
noise.
Yeah, it's fine. Shifting
Let me cut out
focus.
that. Want me to cut it out?
Yeah, we should be able
Yeah,
to.
hold on for 1 second. Sorry about that, gentlemen.
No worries. Mike, next question's for you, really around strategic advice for leaders here today. So if you're advising a health system CEO today, where would you tell them to start as it relates to navigating this new AI landscape?
Well, every health plan is different. And so there's not one pat answer. And I think it's a mistake to focus on one area, especially because of the complexity. One, AI gives you the opportunity to reduce admin cost, gives you, as Ken said, reduce medical cost. It also gives you the opportunity to improve healthcare. It also gives you the opportunity to improve the overall member experience, making things easier to use and so forth. So there's a lot of different lenses where when you look at a health plan, kind of like where's the hurt, if there is hurt, where's the pain points, or where's the vision? So I think our goal is to go in, try to find out what is the vision, what do they want to accomplish, what is hurting. I mean, there's health plans that are making money right now. They may not really, everybody cares, but they may not care as much about that, but their admin costs are going through the roof. So they might want to focus there. So we try to tend to, customize it, and we have the tools to work on all those avenues now. And so we can customize it, come up with a roadmap, and then move forward from there. So that's what we advise. What we do also advise is make sure you have that understanding, make sure you have that roadmap, and that you agree on what it is you want to target. Don't just say, hey, here's a bunch of money for AI to your team and, you know, not have a vision and an outcome waiting for you at the end.
And Ken, from your perspective, once data and workflows are aligned, how do you turn that into like real value?
Yeah. So the simple approach with Medecision is obviously we already have the data management, we already have the workflow, user permissions, security, etc. Leveraging that to then extend into agentic workflows is rather simple. And really what we want to focus on is what exactly Mike said. Does the health plan want to focus on reducing its administrative costs to gain more efficiency, internal operation efficiency? Does it want to look to unlock medical cost savings? Simple answers. Want to do, streamline your process to get closer to that Mayo experience and reduce your administrative review time. Well, then we could deploy a number of agents within that workflow easily and quickly, whether it's identifying missing documentation, whether it's doing matching and assisting the review. We can deploy that. If you want to go and you want to unlock additional medical cost savings, we can look at things of very simple through your medication spend, identify members that have opportunities for lower cost, have the agents go through, identify them, and then make recommendations for lower cost recommendations for a pharmacist to review and then finalize and push out. So we can unlock and, enabling folks to manage X, 3X the patients they normally, or members they would normally manage for lower cost drug alternatives, to, helping streamline the process to get quicker decisioning and reduce those turnaround times to get the care that member needs at the right time. So there are a number of things that we can go, but I think it's what Mike said, making sure that we're not just deploying. And that's the one thing we wanted to make sure is, from a technology perspective, we're not forcing you to use our agents. We are building the agents to your workflow, building the agents to your business objectives and goals and operations. So it's not a point solution agent to do or a point solution agent over here. We will sit down and understand the objectives of the organization and deploy the agentic capabilities where they are most needed and get the quickest return on investment.
Like it. Last question for gentlemen before we wrap things up, really around the human side of AI. So Ken, staying on you for a second, then kicking it over to Mike to wrap up here. How does AI help reintroduce humanity back into healthcare?
So for me, I see it to provide the opportunity for the clinicians, the medical directors, the care managers, the pharmacists, whoever is part of that care team, to be able to spend more time with the members and patients handling those complex moments of time, right? Each person has those inflection moments that need help, and this enables our customers to be able to provide that moment in time care. I know everyone has, it's a cliche, it's been used, right care, right time. Well, the reality is that, to be frank, for the past 10 years has been all talk, right? It has not been able to be delivered at scale. And what we started with the data platform re-architecture to the, event-driven workflow, now adding agentic capabilities, really it's a moment in time now that right care, right time becomes a reality. And we're enabling the clinical staff to be able to spend more time at those moments that matter most and not having to deal with those administrative burdens that just waste time that they could be spending helping members when they need it.
And thanks so much, Ken. And Mike, last question before we wrap things up. I know you work closely with provider organizations. What does rehumanizing healthcare look like on the ground from your point of view?
Well, to be blunt, with all good intentions, health plan, everything that evolves around delivering care, we've made it super complex and we made it onerous on individual providers. We don't want providers filling out forms. We want to be informing providers on what's happening with the patient, what's their history, what else other cares that they have received, what other care have they received, what other prescriptions have they taken, what is their social determinants. You look at that and say, okay, where do they live? Different to provide care to someone in a setting where they have access versus someone who doesn't. So all of those things, as we develop these capabilities, they're going to reach far into the provider community, whether it be the local physician's office or the hospital ER, so that the information is king. And we started out with that at the beginning of this session. Can we get the data cleaned up? Well, it's not just the data within the health plan silos, it's within the provider community, and it's universal data amongst all the different providers, different health plans, because patients don't stay, members don't stay with one health plan and one location their whole life. They move a lot. So this ability to gather all that and get it in front of the provider of care. All right. It does matter how fast we can process things, and, revenue and payments are all very important, but getting those walls broken down and that difficulty, that complexity, and that, filling out 10 pages for one patient on an electronic health record, that's where I think it could really matter and free up people, free up the provider community with additional information so that they're even more effective than they are.
I like it. Gentlemen, I want to thank you both for joining me on the Slice of Healthcare podcast. Look forward to future chats, but thanks so much for being here today.
Thank you,
Thank you,
Jared.
Jared.